It's obvious that from what you've said that, climate change is hugely destabilizing. It's affecting migration. It's affecting these types of outbreaks we're going to be seeing, wars, all kinds of effects. But not only on this macro level are we seeing the effect, but we're also seeing it, specifically on the vulnerable populations, such as moms when they're pregnant. So could you speak a little bit about just how this is now affecting mothers who are pregnant, especially when they're under duress environmentally, either because of a drought or because of the pollution, air pollution in their city?
Yeah. So what we have found out, again, based on the science, the last 15 years, is that climate change not only impacts globally, the atmospheric temperature, impacts the sea level, causes disturbing weather events that we didn't expect, and drought and so forth. But also what we are finding out, and there is significant scientific data now, is that climate change worsens the already existing air pollution, like smog. So burning fossil fuels, like driving your gasoline or diesel car, power plants that burn oil or coal, are the major factors in creating greenhouse gas emissions that are responsible as human actions responsible for greenhouse gas emissions in the environment and climate change. So it is burning fossil fuels that causes a lot of the air pollution problems. The smoke, the very fine particulates that we breathe. And we know that air pollution kills people. I mean, just want to be, plain and simple. It causes premature deaths. It causes heart attacks. It causes respiratory illnesses. It causes severe asthma. And it affects, as I said earlier, the very young, the very old, people with preconditions like asthma, but also pregnant women. We know that air pollution, and we found out now the same thing about climate change and the impacts of climate change, can cause early birth, stillbirth, and also low weights and other impacts like autism and neurological impacts. Even diabetes, some of the data we have seen. So we should not be surprised that climate change worsens air pollution, and as a result, we even have bigger impacts of air pollution to these populations. And let me go to mothers and minorities. What we know is there is inequality across US, and I would suspect it's the same in your country and other countries, how we protect from air pollution and toxic substances impact minorities and poor people that live in communities that are close to power plants, close to ports, close to highways. If you live close to a highway, you have higher exposure from air pollution, from emissions from cars and trucks. And these are the populations that now are disproportionately impacted by climate change. So mothers that live in these communities where the air pollution is higher than another community where the well-to-do live, and they have means to protect themselves. We see the impacts now on Black women. And actually, the study that you refer to, I think there are 57 studies that started back in 2007. And this is what we call epidemiological studies. They are based on actual individuals and their exposures. So they're not based on animal test data. So we tend to put much more significance on epidemiological studies because they're basically humans that are impacted versus the data that we get from animal testing. So based on these 57 epidemiological studies, we have seen that climate change worsens air pollution. As a result, we see the impacts on Black women, minorities, and women with asthma when it comes to prenatal impacts.